One of the most common questions I get towards the end of pregnancy is, should I get induced or should I wait to go into labor spontaneously? And this is a relatively new question because until recently, we had this belief that if we induce labor, it increased your C-section risk. And that had to do with the data that we've had for many years of when we induce people, there was more C-sections. But what was not accounted for was the reason why we induce people. And when we induce people for a medical condition, for example, if the mom is sick, if she has hypertension, diabetes, or if the baby is growth restricted and small and there is an issue with the baby or the mom, we weren't sure if it was the induction that caused the C-sections or was it the fact that the mom was sick or the baby was sick. So they did a very large trial called the ARRIVE trial, and what they did is they took a bunch of moms, first-time moms that were head down in term, and what they found with this trial was that the moms that were induced at 39 weeks had the same or less C-sections than the people that waited. And that really changed practice patterns to the point now where we have to have a discussion on what is better. Because if you look just at the medicine, you'd say, okay, if the C-section risk was lower and if you look at the data on how things happen with the pregnancy, we know risks go up as you stay pregnant. So should we just induce everyone? So this became a lot more nuanced of a question, and in this video, I'm going to try to help you decide on what's best for you. So when I'm sitting in my office and I'm talking to a patient, I usually break it down like this. The first thing I usually ask people is, what do they want? And some people already know. So I'm going to explain the extremes, because if you understand the extremes, you understand the middle. And then we're going to go through a series of questions to help you figure out what works best for you. So given that there's more of a nuance now on the safety of induction, how do you know what's best for you? And the answer to the question depends on a few things that we're going to address into this video. So now that we have these options, I'm going to paint for you a continuum, and I'm going to talk about the extremes, because if you understand the extremes, you understand the middle. On one end, you have completely natural, and when I say natural, I mean the way your great-great-grandmother did it. I'm talking about no anesthesia. I'm talking about minimal interventions, and that is beautiful, especially for the people who want that. And I will tell you personally, one of the most amazing experiences I have is when I'm with a patient in a room and they do the work, and we'll definitely do a video on what that work is, to become completely present through the waves and surges of these contractions. And for the right person who is aligned with that, to go through the trials of labor and finally hit that climax of delivery and holding their baby for the first time is one of the most beautiful moments. The thing is, that's not for everyone. When you see that on social media, the internet, etc. But a lot of times when I find, for example, people cannot get into that mental state, a lot of times it could be quite a traumatizing experience, and we have to meet people where they are. So as beautiful as it is for some people, and if you just went on TikTok and Instagram, that's basically what you'd see, is you miss the nuance where everyone else is. And on the other side, we have a scheduled induction. Some hospitals, doctors, providers start pushing inductions because of convenience for the doctor, which I think is inappropriate. But the question is it convenient for you? So like when we're talking about an induction, obviously there's medical reasons for an induction, but I'm taking the position of assuming that you're healthy, you have no other issues. Who chooses to induce? The reasons to induce are simple. If I told you that the health risks are the same, right, then why wouldn't you? You can choose the time, you can choose the date, you have control. So the induction side works really well for control. And I find for people who do not feel their baby move much, if there's a lot of anxiety, or if there's a social component. For example, me and my wife induced our kids because I was in residency. I got 1 week of paternity leave, and we wanted to spend more time with our children. So for me to add another vacation week, we had to plan, and that planning allowed us to have 2 weeks with my daughter, which was great. So for us, for example, it made more sense to induce. Some people, when it's their second and third kid, sometimes they don't know who's going to watch their other kids. So there's a whole social component that may have people choose to induce. So that sounds great and perfect. So then why doesn't everyone induce? And the reason why is the experience can be very different, especially for first-time moms. When you are induced, it's a very medicalized situation. You're in the hospital, there's monitors, there's medication. And for some people who like control and they can see the baby the whole time, that is great. For someone that would like some more movement and not be in the hospital for so long, because for a first-time mom, average time is 18 hours, that might not be the best option. And by the way, 18 hours, it could last 2 to 3 days in some cases. So the downside to an induction is clearly the experience. So what I find mostly is most people want something in the middle. And how do they choose, right? So most patients, what they tell me is something we can't give them. They want a surprise party with an invitation. So we have to make a choice. Do you value spontaneity, going into labor naturally and taking the risks that come with that? Or do you prefer control and deal with the downsides of control, which is the atmosphere and the experience? And by the way, a lot of times those experiences are positive, but just note, it's going to be a lot more medicalized. So how do you make the right decision for you? I find most of my patients, by the way, are somewhere in the middle. They want an epidural. Obviously, if you are someone that wants who does not want an epidural, this whole induction situation is not ideal. Usually the contractions come on stronger and faster, and you do not get the same buffer of the endorphins that you get when you get contractions naturally. So if you're someone inclined to do that, I would do the most you possibly can to avoid an induction. But let's say you don't know where you are on that continuum and you want to know if this is the right option for you. The first question I would ask is, how important is spontaneity for you? Are you someone that likes the control, that wants to know when things are happening? Or are you someone that wants to feel that your body went into labor naturally? Medically, it's the same. So the question then comes down to the experience that you want. The second question I would ask is, how comfortable do you feel with uncertainty past your due date? If you look at the charts and you look at C-section outcome and also bad outcomes with the baby, actually starting at 36 weeks, it starts going like this, and actually about 40 to 41 weeks, a little more. And then actually you look at the fetal demise risk between 41 and 42 weeks, it doubles. That sounds actually like a huge number. It isn't. It's actually a quite small number if you look at the absolute amount of numbers. But still, when you're talking about your baby, if I told you if it was 1 in 1,000, you may say that is a lot or a small number. So when it comes to uncertainty, that is something to talk to your doctor about on what risk you're willing to take, even if they're very, very small. Because now that we have data that there's no harm in inducing, then I think it's worth bringing up in conversation. The third question is how tolerant are you about being in the hospital? So we kind of talked about the advantages of induction, which is the timing and having control. But the average time for an induction is 18 hours for a first-time mom, and occasionally they can be longer, 2 to 3 days. And the patients that tell me that they like the idea, even if it's longer, are the ones that tell me, I'd rather it be 2 days than 2 weeks, because if you induce at 39 weeks versus waiting until 41 weeks, that time process is still faster. The people who tell me that they rather wait, they don't care if they're pregnant a week or two longer. It's more of the time in the hospital with the medical interventions that they have an issue with. Again, also the contractions can be stronger, and if you're someone that does not want an epidural, the experience may be quite unpleasant. Question number 4 is, do you want a firm plan or a flexible plan? So when we're talking about birth preferences in general, we want to know, what is your ideal situation, understanding that we may need to pivot. And if the ideal situation for you is spontaneity, going into labor naturally, coming into labor more and more dilated, and having a baby with the least amount of interventions, an induction is a bad idea. But if you're someone that wants to know, for example, how we did, and make sure I was able to spend more time with our kids, or say, by the way, sometimes spouses travel a lot and they need to find a way to increase the chance of them being there. People have life circumstances. An induction would be better for that person. So finding the nuance and what works for you, it's most important. I know you're going to hear just about every story on social media on, I got induced and ended up in a C-section, or I got an induction, it was amazing, or I got a C-section, it was amazing, or I got a C-section and I had all these negative things. So finding what works for you is what's most important. The last thing I want to say as far as experience goes, if I told you the C-section rate was the same, but the difference is for the people that ended up in a C-section, the experience of going into labor, spending a few hours in the hospital and needing a C-section for whatever reason is very different than being there for 2 days, not progressing or having an issue, and then needing a C-section after 2 days of being in the hospital. So that experience, if it doesn't work out, is something I think people don't talk about enough. And for a lot of people, that is the biggest fear of induction is, okay, even if the C-section rate is the same, the most long tiring labors and then ending up in a C-section could be very grueling, especially when you're about to take care of a newborn. I hope you found this video helpful. If you're still unsure if you're going to have a vaginal delivery or a C-section, watch the video here.